Hey everybody, this is Kirsten Short with the Houston Health Department. We are here for our Measles 101 and 10. I will give just a couple moments to see if people come on and join us, and then we'll go ahead and get started. All right, so let's go ahead and get started because we're right at noon. So again, as I mentioned, I'm Kirsten Short. I'm the Chief Epidemiologist with the Houston Health Department, and we are here for our Measles 101 and 10. It's been, a few minutes since I last talked to you guys. And so I did want to come on and be happy to join you today. And we've got some good news to share. If you haven't seen it already in the media, on August 18th, the West Texas measles outbreak was declared over. So that's great news. We are celebrating. Our colleagues over in West Texas are certainly celebrating. And everybody's feeling pretty happy about that. So I want to talk with you a little bit and explain, what does it mean? How do we determine that an outbreak is over? So generally, for an outbreak to be declared over, we want to go through 2 incubation periods without any new cases associated with that outbreak. So if you remember, when we talk about an incubation period, that's the time from when you might have been exposed to a disease, right, to the time when you develop symptoms. So it's the time that that virus or that bacteria is incubating, right, replicating, multiplying inside of your body enough to the point where you develop symptoms and then generally have become infectious and able to spread it to somebody else. So for measles, we look at like the maximum incubation period, and that's generally considered 21 days. And so we want 2 cycles, so 21 days, 42 days. So we have gone 42 days without a new measles case that was able to be linked to our West Texas outbreak. And so that was what allowed us to declare that the measles outbreak was over. So now that we're finally here, we're finally on the other side of this. Let's remember, we've been in here basically since kind of mid-January. So it's been about 8 months. I want to kind of just sort of summarize up things where we are. I'm going to put some numbers up. So I'm going to make my notes to make sure that we don't misspeak, right? So between January and August of this year, the West Texas measles outbreak, they had 762 cases across 37 counties. Now, the majority of that was in West Texas, but we also saw cases all the way over in El Paso. We saw cases all the way up in Lamar County. We saw some cases down in the Hill Country area. So we did have sort of little bits and tendrils of pieces that extended beyond sort of that immediate area where the epicenter, as we would call it, the center of the outbreak happened. So of those 762 cases, there were 99 people that were hospitalized for measles. So that's about 12% of those cases were people that ended up needing to get hospitalized for some level of care. We also, unfortunately, as was reported in the news, we did have 2 children who passed away. So we had 2 fatalities. And those were children who unfortunately were not previously vaccinated against measles. When we also look into it in terms of the groups who were vaccinated or who were impacted, we know that about 30% of those cases were kids under the age of 5, so those littles. We know that about 38% were also children, but between the ages of 5 and 17, so what we would consider sort of school-age children, right? And then the remainder, which is about 32%, were over 17 years of age. We also know when we look at prevention, right, of those 762 cases, only 21, which is less than 3%, had received 2 doses of the MMR vaccine. So that would be what we would consider to be fully vaccinated. We know that another 23 people, which is 3%, had received a single dose of the MMR vaccine. So what we would call partially vaccinated. They had some level of protection, but not what we would consider fully protected. So the rest, so that's 94% of the people who got measles, were unvaccinated or had an unknown vaccine status. So we know, we've talked about it before, the vaccine is really the best way to protect yourself, the people you love, those around you, from measles. But continuing into the vaccine trend, I want to talk about one of the things that's been reported in the media and celebrate the fact that in Gaines County, which was sort of the center of the outbreak, it was reported that 300 vaccines were given. So for those of us that live and exist and work and breathe in, Houston and the surrounding areas, 300 vaccines doesn't sound necessarily like a whole lot. But we need to remember that we live in a city of 2.3 million-ish, right? And Gaines County is a much smaller area. They've got, about 22,000, maybe 23,000 folks in their county. So like the scale that we're talking about is really different. So if we look at 300 vaccines and about 22,000 people, that's about, 1 to 1.5% of their population. So if we put that into Houston and we say we were going to vaccinate 1 to 1.5% of the population of 2.3 million, that's over 32,000 vaccines. So that number sounds much bigger now. It sounds like a much, so just kind of remember when we're talking about things and looking at things to kind of put it in the context of the community. So I really want to, thank all of the people that were willing to go out and get vaccinated and all of the people that went out and made it available. So I see we've got a question over here. Now that the outbreak is done, do we have nothing to worry about? So I want to talk about that a little bit. That's actually just where I was going, right? So during the same time in 2025, between January and August, we've also had 39 cases of measles across 19 counties in Texas that were not linked to the West Texas outbreak. So there was all this attention about the West Texas outbreak, but we also had a lot of other measles activity happening. We are also this year at the highest number of measles in the United States in over 30 years. So far, we're not done with this year, remember, we're in August. We've had 14,008 cases of measles reported in the United States. The last year that we had more than that was back in 1992. So there's still a lot of measles going on. The risk is pretty low, right? Especially if you're vaccinated, but it's still out there. Measles is still spreading. We still have a pretty large outbreak that's going on in our neighbor to the north up in Canada. We have another large outbreak that's going on to our neighbor down the south, down in Mexico, right? And there's just measles that's spreading in, nearly every region across the globe, quite honestly. So we need to think about what can we do. I've already mentioned it, right? So we know that vaccines are the best protection, right? And we know that you can get your first dose of the MMR vaccine at 1 year of age, so at 12 months and 1 day, basically. And then you generally get a second dose around age 4. You can get that second dose a little bit earlier. So as long as you wait at least 28 days or 4 weeks between the doses, you can get that earlier and still be valid. We also know that if you're traveling, I mentioned measles is kind of going on sort of everywhere in the globe. So you might want to get some of those kids that are too young for that official first dose, if they're under 1 year of age, so if they're between 6 months and 12 months old, you can actually get them an early dose. You can talk with your pediatrician about that. And that will give them some level of protection in case they encounter somebody who may be infectious, whether they know it or don't know it at that time. And then you would need to go back with your pediatrician and do those follow-up doses when their immune system gets a little bit older as they go over that 1 year age threshold. But that is an option if you're looking at doing any sort of traveling. And the other thing I want to talk about is, what do you need to think about if you think you might have measles? You've done what you feel is all the best things that you can do, whether you're vaccinated, whether you're not vaccinated, but you think you might have measles, right? So you'll hear public health folks say it all over. You'll hear your doctor say it all over, right? Stay home when you're sick. So if you think you have measles, one of the best things that you can do, right, is stay home and away from others. Because what you don't want to do is go out and about and then potentially have other people get exposed and maybe also develop illness. You also want to go and talk to your doctor or your healthcare provider to find out whether it is measles or whether it's something else that might have been confused with measles. And before you go into that healthcare system, call ahead. Now, if it's an emergency, obviously you need to take care of that emergency. But you do want to let the folks, when you call, let them know, hey, I think I might have measles. I was exposed to measles. My cousin said they had measles and I was hanging out with them last week. That way, that provider can make sure that they bring you into that healthcare facility in a way that minimizes risk to other people. So that if you do have measles and you are infectious, it's really going to reduce the chances that somebody else is going to get infected from being around you. So that's about it. I'm going to sign off. But before I do, I just want to take a quick moment to say thank you. And I really want to separate it out to three different groups of people. So I want to thank our team here at the Houston Health Department and really all of the public health departments in our region and across the state for all of the extra hours that they put in over these last 8 months responding to measles. I also want to thank all of our providers who call in so quickly when they've had concerns about a patient with possible measles or when they wanted to make sure that they were doing the best things for their patients and their clients in terms of how do I bring somebody in safely and all of those other questions that they might have. And lastly, I really want to thank all of you in the community for tuning in and for taking time out of your lives to make sure that you had the best information possible to protect yourselves and then those you love and those you care about. I hope that all of you guys who watched and listened were able to take some information back to your circle of friends and family to be, kind of talk about the trusted messenger, to be that person in their lives that they will listen to help protect and your family, to help protect your community. Because those of us who work in public health, that's really what it's all about, is protecting the health of our community that we all live and work in. So thank you guys. We'll talk to you later. Bye-bye.